Investigations are underway following a fire that has left many parts of the Christiana Hospital destroyed in a blaze. Health MEC Madoda Sambatha visited the 96-bed facility to assess the damage yesterday afternoon. Sambatha joins me now for a conversation about this. MEC, thanks very much for your time. So you went to assess this. What did you find?
Thank you very much, Toli, and thank you very much for hosting us. Yes, I did. I went to check the hospital as it was burning. On my arrival, those that were there when it started only confirmed that it started burning on the side where there's construction workers doing the work. Remember, the hospital is under a very serious refurbishment program, which should have been finished and handed over to the department on the end of September this year. What had happened is that because it started where the construction was, it made that easier and possible for them to then evacuate patients, all of them, transfer them to a nearest hospitals in the sub-districts and some in the district, and that workers and patients were not affected by the blaze, which gutted down the hospital into ashes.
The suspicions, MEC, of foul play, can you say anything along those lines, or is this still under investigation?
This is still under investigation. I would not want to give you any suspicion, because if you would have monitored and checked how the construction has progressed, the facility was ready for fully operation after refurbishment. So we still are not sure as to what might have been the reason. Remember, on the same day, almost same period, a hotel was burning in Mahikeng. But police must do their investigation without any guide of speculative views.
MEC, we are in the middle of a global pandemic. The impact of this hospital being burnt down on the vaccination rollout, but also in making sure that you have enough bed space in terms of those who might need hospitalization.
It's very serious. 96 beds gone just in less than 3 hours. And this was one of the hospitals that was doing very well in terms of vaccination. What we then have to do, we have requested management to work out on a plan. First, the plan must relate to how do we then deepen and strengthen the process of vaccination at community level, now that the hospital is not there. But also deal with the reality as to where do you place the employees of the hospital that has been gutted down. The third component is hospital services in the area. How do we approach that now that we do not have a hospital, so that by next week, Monday, they come up with a whole holistic plan as to how do we approach vaccination, how do we approach the issue of where workers are going to work, how do we approach the issue of accessibility of hospital service in the area without subjecting them to the problem that now that they don't have a hospital, they might end up not having access to hospital services.
Finally, MEC, you mentioned that this hospital was at 95% completion in terms of its refurbishment and was nearing the stage where it was going to be handed over to your department, I would assume. Which sphere of government was funding the refurbishment of this hospital?
The funding was funded by the National Department of Health. Remember, National Department of Health has many programs that it does with provinces. There are programs that are directly funded by National Department of Health, yet they are suggested by the province. That's one of them. The second one they are involved with, it's Klerksdorp Tsepo.
And how much money had been spent thus far, MEC?
The budget for the whole project was around 95 million. And I can tell you, in terms of expenditure, I'm sure it's going concurrently without they've finished, because they have been doing very well in terms of working on complying with what was outlined on the basis of refurbishment. The total budget was 95 million then when it was approved.
So 95 million down the drain.
That's what it means, really, and that's what is painful, though. The only consoling component is that no life has been lost.
MEC, I must let you go because I understand that you are part and parcel of the Deputy President's vaccination campaign. He is in your backyard. How is vaccination going?
Vaccination in the province was one of those provinces that has picked up very low success in terms of vaccination. As we speak of now, vaccines administered to everybody constitute 739,000. And in those vaccines, people who have actually been fully vaccinated, they constitute 536,000. And as a province, one of the areas that is not doing well on registration and vaccination is Bujanala. And in Bujanala, it's in Rustenburg, where the Deputy President is. The population of Rustenburg is around 780,000, yet registered people are only 96,000.
All right. MEC, thank you very much.